the cardiac cycle or the chain of electrical events that occur during a heartbeat. The process of depolarization begins at 1, that is at SA node, passes to the atria, that's number 2, and then at 3 it passes across the AV node to the ventricles. In the ventricles it travels along the right and left bundle branches marked 4 and then through the Purkinje fibers to the ventricles. Now correlating the events to the ECG recording, the process of activation, that is depolarization, begins at the sinoatrial node or the SA node situated in the right atrium. Within 0.06 to 0.08 seconds, the atria get depolarized, which is recorded on the ECG as the P wave. The wave of depolarization has to reach the ventricles through the AV node, which delays the impulse by 0.1 second. During this time, there is no significant electrical activity and ECG records it as the isoelectric PR segment. Now, as the impulse spreads throughout the ventricles within about 0.1 second, the septum gets depolarized first, then left and right ventricular walls almost simultaneously, but a little earlier on the left side. This activity is recorded as the QRS complex. Once the ventricles are totally depolarized, there is no electrical activity for a brief period, so the ECG returns to the isoelectric line and records the ST segment. Then the repolarization of the ventricles begins and is recorded as the T wave. The repolarization is much slower than the depolarization, and so the T wave is broader than the QRS complex, but it is in the same direction as the main wave of the QRS complex. Now we come to the second section on interpretation of PQRST patterns. Calculation of the heart rate. The heart rate is calculated by measuring the number of small squares between two successive R waves. 1500 divided by this number gives us the heart rate per minute. The standard ECG paper runs at a rate of 25 millimeters per second. So each small square represents 0.04 seconds and each large square represents 0.2 seconds, and 1500 small squares represent 1 minute. In this ECG, the RR interval measures 10 small squares. So the rate is 1500 divided by 10 equal to 150 per minute. A rate above 100 per minute is termed as tachycardia. In this second ECG, the RR interval is much prolonged. Let us count it taking help of the large squares in thick lines after every 5 small squares. The RR interval is 28 small squares. So the heart rate is 1500 divided by 28 equal to 54 per minute. A rate below 60 per minute is termed as bradycardia. In this ECG, count the RR interval. It is 18 small squares. So the rate is 84 per minute, that is within normal range. So normally the RR interval should be between 15 to 25 small squares or 60 to 100 per minute. Now in this ECG, the rhythm is irregular. Each RR interval is different. So in this case, count the number of R waves in 15 large squares which represent 3 seconds and multiply the number by 20 to get an approximate heart rate per minute. This tracing shows 5 R waves in 15 large squares. So the rate is about 100 per minute. So before a heart rate is calculated, see whether the rhythm is regular. We must also remember that RR interval actually measures the ventricular rate. In total heart block, where P waves do not correspond with the QRS complexes, the atrial rate should be calculated separately by measuring the number of small squares between two P waves and dividing 1500 by this number. In this tracing, the PP interval is 15 small squares and the RR interval is 50 small squares. So the atrial rate is 100 per minute while ventricular rate is 30 per minute. Clinically, what we count by palpating the pulse is ventricular rate. Atrial rate can be seen only on ECG. axis deviation